Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is angiology of heart. And today we will try to discuss about the angiology of the heart. So let us start. First of all, what is angiology? Angio means vessels or artery, and logy means knowledge or to study. So now, what is angiology? If this is a heart, this is right atrium, this is left atrium, this is right ventricle, and this is left ventricle. Now, here comes the superior vena cava and inferior vena cava, and from this this SVC and IVC, or superior vena cava and inferior vena cava, collects the blood from the body, and this is deoxygenated blood. Now this deoxygenated blood comes in the right ventricle and goes to the lungs for purification. After purification, it comes to the right atrium. Then it goes to left ventricle. Then it comes out. And this oxygenated blood now going to the all the cells and all the body parts. So the pathway is, this is the ascending aorta, and this is arch of aorta, this is descending thoracic aorta, and below this is descending abdominal aorta, and this part is which differentiate is diaphragm. And you see that here are three parts in case of arch of aorta. This is left subclavian artery, this is left common carotid artery, and this is brachiocephalic trunk, which will further differentiate into two parts, and one is grow as right subclavian artery and one is right common carotid artery. So what is there? Arch of aorta, three divisions. One is brachiocephalic trunk, one is left common carotid artery, one is left subclavian artery. And brachiocephalic trunk will further continue as in two parts. One is right subclavian artery, one is right common carotid artery. And this subclavian artery will continue to the extremities, both. More specifically, it is in right hand and this is in left hand, and this common carotid will supply to the head, and it's come from the heart, from the left ventricle, and from the left ventricle it comes with the ascending aorta, then arch of aorta, then descending thoracic aorta, then through the diaphragm it goes to the descending abdominal aorta. So these are the basic structures of the angiology of the heart. Now when this pierces the diaphragm, here are three major openings in case of diaphragm. Now if you start the diaphragm, so what is a diaphragm? First of all, diaphragm is a fibromuscular partition which is present between the thoracic and the abdominal cavity. So what is the diaphragm? Diaphragm is a fibromuscular partition which is present between the thoracic and the abdominal cavity. It is the diaphragm, and the major openings you can remember as a trick Voice of America, which is a major broadcasting channel in case of America, and you take the first word or first letter VOA. By V it means the vena cava opening. By O it is esophageal opening, and by A it is aortic opening. And the vena cava opening is present at the level of the lower border of T3, and it is then the esophageal opening is present at the level of the lower border of T10, and the aortic open is present at the level of the lower border of T12. So these are the major openings of the diaphragm. Now continue with the arch of aorta. So what is arch of aorta? Arch of aorta is a part of the aorta which is the continuation of the ascending aorta, and it is present at the level of the right second sternocostal junction or the sternal angle, and it is more present at the anterior level, and it ends by the continued as descending thoracic aorta at the level of the sternal angle, but it is at the posterior part. So what it is trying to say? So it is the part of the aorta. So it is a part of aorta which is the continuation of ascending aorta, and it is present at the level of the right second sternocostal joint. Right second sternocostal joint. And it is the junction which is present like the, it is also known as sternal angle, and it is present in the anterior level, and this is the beginning, and it ends by the continued as the descending thoracic aorta and at the level of the sternal angle, but it is at the posterior part. So this is like this. This is the anterior part and this is the posterior part. Now we will discuss about the course of the arch of aorta. After beginning or starting arch of aorta, it ascends upwards and slightly backwards in front of the trachea, and then it goes above to the left side of the trachea, and finally it ends at the sternal angle by continued as the descending thoracic aorta. So what happens? After beginning or starting arch of aorta, it ascends upwards and it goes slightly backwards and in front of the trachea, then it goes above the left side of the trachea, and finally it ends at the sternal angle by continued as the descending thoracic aorta. So this is the course of the arch of aorta. Then we will start about the relations to the arch of aorta. Relation to the arch of aorta. Now relation means what are the structures that correlates with the arch of aorta with different sides. Now first anteriorly, where you see the anteriorly it meets with the trachea, then esophagus, then the thoracic duct, then posteriorly the esophagus and the vertebral column. Then superiorly, if we see superiorly, then there are three branches from right to left. Number one, brachiocephalic artery or trunk. Which will further divide into two parts. One is right subclavian artery, one is right common carotid artery, and this is the widest branch. Number two, left common carotid artery, and number three, that is left subclavian artery. And brachiocephalic artery or trunk and the left common carotid artery supplies the blood towards the neck and the brain. Now, upper extremity. How it supplies, we will see that. The left subclavian artery, which will supply the left upper limb as the axillary artery. Then it will go to brachial. Then it will divide into two parts. One is radial, one is ulnar. And then there will be two branches. One is superficial pulmonary arch, one is deep pulmonary arch. So these are the supplies of the upper extremity. Now we will see the inferiorly relation. Inferiorly, number one, that is bifurcation of the pulmonary artery. So this is the pulmonary artery or trunk, and this is the ligamentum arteriosum, and in case of pulmonary artery, this is the left pulmonary artery, this is the right pulmonary artery. And right and the left pulmonary artery bifurcates at the level of sternal angle. So this is the level of sternal angle. Number two structure, that is the ligamentum arteriosum, which connects between the left pulmonary artery and the arch of aorta. Number three, that is the left recurrent laryngeal nerve, and number four, that is the left vagus nerve. So these are the all structures which are associated with the arch of aorta anteriorly, superior, anteriorly, posteriorly, superiorly, inferiorly. These are the all structures of the arch of aorta. So today we have started at the angiology of the heart, and in case of angiology of the heart, we will discuss only about the angiology of the arch of aorta. If you have any query or any doubt related to these topics, you can ask me in the comment section. I will try to reply them all. And if you have any doubt, you can also ask that. You should do so. You should do like and subscribe to my channel for supporting me and my channel. And thank you so much for the watching of the entire video.